Hello there. Wanted to walk you through a quick sample of some patient leakage reporting with using HSG's 90-day patient flow, where we're able to track patients utilizing claims-based data from both fee-for-service Medicare and commercial payers to track how those patients are flowing over time. So being able to understand what is our keepage within our health system specifically. So starting with maybe an overall summary dashboard where we might be looking from source employment status being the primary care grouping that we're focused on. So maybe starting with our employed PCPs to within the entire 15 county service area. So when we look at our employed PCPs, our capture to general surgery specifically is approximately 30% to our employed general surgeons, 80% to our employed urologists, so we can start to identify, significant leakage opportunities that exist at the overall system level. Then over on the right, being able to understand what are those relative patient volumes to our health system so that we can start to understand that overall impact organizationally. We then have the ability, if we wanted to look at just maybe, let's look at Carter County specifically, where we can now see for our primary care practices in Carter County, that are employed, what does that look like in our ability to keep patients within the system, with the light blue portion being active medical staff specialists that might not actually be employed by our system. We then get into specifics of what does that look like by practice. So then these would be the 4 employed primary care practices we have within Carter County. What does their volume look like to those same surgical specialties? So we can see across the board where we see that employed primary care practice C is actually, our biggest opportunity for improving keepage for general surgery specifically as we look down. Subsequently, if we looked across for the employed primary care practice B here, where we could be able to see that ophthalmology, podiatry, we have significantly higher leakage to outside the system than our ability to keep within other surgical specialties that we're measuring data on. We then have the ability to see the specific volumes, once again, that are feeding all of those separate figures. And then the last piece we have the ability to get into, or the second to last piece, is getting into the individual providers within that practice. So we could see if we looked at employed primary care practice A, within Carter County specifically, what are the actual, for those providers, there's, these 6 providers within the practice itself. If we look at provider A, we see that podiatry, ophthalmology, significantly higher leakage specifically, while very high keepage for urology, ENT, and plastic surgery. But subsequently, if we then looked at general surgery, we see that provider E, provider C have much higher leakage volumes percentage-wise to general surgery specialists within the market and outside the market. The last piece I'll touch on is then one to understand and identify then who is that volume actually going to. So where I'll start is maybe if we grouped all of those providers together within that employed primary care practice A, we see that there's 86 patients going to the actual who this general surgeon in would be available to you. So you actually see who that general surgeon is and his or her name. And you could do that either at the entire practice level, or maybe we want to understand the individual provider level within that practice, where we saw that provider A, there might have been some opportunity for keepage, incremental keepage from that physician specifically, that their biggest volume would be 23 patients or 16% of the whole volume going to general surgeon F. And so being able to identify those specifics on where the patient's coming from, where they're going to for specialty services in a defined time interval, and being able to understand what that means from our organizational, from an incremental capture standpoint, as well as being able to trend that over time to understand what does that look like and are we making incremental improvements. If you have questions on patient leakage overall, or have incremental questions that you'd like to discuss, please reach out to me directly, DJ Sullivan, Director with HSG Advisors. Be happy to set up a time to talk to you specifically. All the best and talk soon.